We do have a. Yeah. Can we have a motion to approve the minutes of the last meeting? Second,
Seconded.
all in favor?
Aye.
I don't see any members zoomed in. Everybody's here except Sharon, who is excused. Okay, so we don't have to do a round robin votes.
Just remember a discussion after a motion and a second,
Yeah,
as Carrie pointed out.
okay. All right. Okay, so we have some policy manual things to review, okay? Has everyone had a chance to look at those papers through the email? Okay. The extremely lengthy legal information about charges and discounts, et cetera, which was, I found extremely confusing, even though I've done that kind of thing before. But it looks like it's still okay for us to go ahead and do immediate pay discounts for the people who don't have insurance. So, I think we need to note that we have reviewed that. The next thing is to, the infection control policy.
So we need to we just need to approve the schedule now. Go back to your fee schedule.
Oh, I thought that was the next thing. I'm sorry.
I just have it all on the same line. And
Oh, you
approve the
do.
January
All right.
2026 fee.
So now we
schedule.
have the fee schedule from the last meeting that we can approve. We have a motion to approve this schedule.
So move.
Second,
Second.
is there any discussion?
No.
Don't hear any? Okay, so all in favor to approve the fee schedule? Aye. Okay. The infection control policy, the old one, which was like 1 page long, wasn't anything like complete. It's been replaced by the new infection control, exposure control policy, and so we can get rid of the old infection control policy in the book. Okay, does, we have to move and second that one? I think so. Yeah. Okay, so we can have a motion to do that. To get rid of the out-of-date infection control policy. Because all of the infection control is now covered in the new exposure control policy.
So
Is there a second?
Seconded.
Okay. Any discussion? All in favor? Aye. Okay. Then there is the prescribing for immediate family, substitution. Those two, the new policy to substitute for the old one. Which is, a new one's a lot more detailed. Do we have a motion to discuss it, if we were support this new policy?
So
Is there a second? Is there any discussion?
I will just add in discussion that the update to this policy was something that was recommended by Dr. Prast on his review of policy. That he had felt that our existing policy left us open to some exposure and provided inadequate guidance, and inadequate alignment with current ethical standards.
Okay. Any further discussion? All in favor of the new policy being accepted in place of the old one?
Aye.
Aye. Okay. That one passes. All right. Now, Chris, it's your turn.
Okay, perfect. So I just have a couple of agenda items today, and I'm going to actually try to pop over to Carrie's computer and pull up our new website. I don't know if all of you have seen the new Islesboro Health Center website.
I was very impressed with it.
Yeah, it's amazing.
Let's
Not minimize. Oh, maybe I can just share the screen.
Yeah, let me try doing that. The Health Center website up. So our new health center website is just islesborohealthcenter.com. So this is our new website as it currently shows up. We now have the ability to edit our own website. So if there are changes or updates that need to be made, those can be made on an immediate basis. And Beth and I both have access privileges to be able to make those changes. We have put up a few flyers in conspicuous places around town, at the ferry terminal, at the library. I still need to get one over to Island Market just to make the community aware that our new website is there.
And Durkee's.
Yes, absolutely. I think there may be one up at Durkee's already.
Okay.
Oh, perfect. Thank you for confirming. So on our homepage, we now have the ability to highlight public health stories, public education, information about our new facility. Owen recently won an award. He was recognized by the Maine Academy of Physician Associates as the Outstanding Healthcare Professional of the Year. Through my knowledge, Islesboro Health Center is the only health facility in the state where all of the PA staff have been recipients of this award. And Owen and I are both recipients of this award. I won it in 2020, 2021 or 22. We have a section on our website that was put in place with some opportunity for expansion in mind, where we can announce health center events if there are open houses, classes that we're planning to run, vaccine clinics. We have the summary of our services available on the website, photographs of our team.
We're gonna need to take Dory down.
So we are, I know, so sad. And for those of us who have provided biographies, if you click on the individual provider, we now have biographies of our individual providers on our website. Information about how to access our mental health services, a community resources page, drop-down menus in various categories for crisis hotline phone numbers, resources for everything from clothing, dental, food and nutrition assistance. We have a very comprehensive new section on tick-borne illness information that includes information about the types of ticks on Islesboro, the various diseases that we see in our tick population, tick bite prevention information, information about testing, including what to expect, which tests take longer to come back. The tests for anaplasma and babesia are only run twice a week at Nordex, so they don't always come back same day. Information about treatment options for Lyme anaplasma and babesia, and general patient-targeted information about antibiotics and antibiotic use. And then we have a section for health center policies. The one we currently have up there is our notice of privacy practices, which we are required by federal law to post on our website. There are going to be some other things coming here as well that we'll need to have posted for compliance purposes. The next one that's going to be coming is our No Surprises Act and good faith estimate policies for billing. And then last but not least, we have a frequently asked questions section on sections on billing and payment, donations, medical services, and I'm anticipating that this will grow and expand as we work with this website. When I had initially built this, I had just wanted to have something available so that if members of the community looked us up, they had something that they could find. And then in some of my discussions with the select board during budget season, it came to my attention that the community really wants to actively engage with this website. So I am trying to get the word out.
Do you have a hit counter?
We don't yet, but I am looking at how we're going to be able to activate one. It looks like there is a mechanism through Google Analytics, and I just need to figure out how to activate it.
Because that would be a useful thing to know. 'Cause I mean, a website
Absolutely,
that nobody's looking at is not particularly useful.
exactly.
And unfortunately, I didn't have the direct link when I wrote the report for the town report, so I put the one that goes through the town thing. But I'm hoping that that will still point in the right direction.
It does, so
It will?
that's still,
Okay,
there is a link for the, if you go to the old website for the town, there is a link to our new website.
Excellent.
The same way that your tick information website is linked on the town
Uh-huh.
was, last time I checked, that's what gave us this idea to
Yeah.
link it that way.
Yeah, excellent, very good.
All right, so any questions on our new website?
Will there come a time when you can do appointment scheduling on the website?
Through this website, no.
I didn't think it had that capacity.
There may come a time that we're able to do that through our electronic health record, but through this website, no.
Right. And is there, I mean, there's no way that a patient could communicate directly to a provider through this either.
Not through this site. Our electronic health record does have that functionality. We have a patient portal
Oh,
that
good.
does allow patients to communicate with us through
Okay.
the electronic health record.
I don't know about that.
Well, the reason you don't know about that is not all the providers are ready to tackle that. But Chris and I are, if you'd like to be a beta subject, I'm happy to.
I'd love to be beta.
I'm happy to include anybody in a link and give it to anybody who's wanting to try it out with the knowledge that not everybody is on board and it's not full functionality.
Hmm. Okay,
But it's a great way to securely chat.
yeah,
And
it's,
I've tried it with a few patients.
uh-huh, yeah, because I mean, it's one of those things where that I found in my previous relationship with my provider extremely helpful because neither one of us had time to go to a phone or, during working hours and have conversations about stuff. And it was very helpful to be able to just say, hey, John, I need this. Can you set it up? And, within a couple of days, I get something saying that, it was all done, as opposed to trying to get people's personal emails or call them on their phones or,
Yeah, well.
for non-urgent type issues. It's really useful.
Absolutely, and it's also HIPAA compliant, which is important.
Yes.
And can help set some healthy boundaries around personal phone use too, which is always a struggle in a small community. And I think that, and Chris, let me know if I'm, if you have a different take on this, but I think that there's just been a whole lot of changes in the past year.
Oh, yeah.
And asking for a staff to take on one other thing felt like too much of an ask. So because it's not just asking the staff to do that, but it's a big ask of the community. Not everybody will want to participate, and we've got to kind of sort out how we're going to manage the varying needs of both provider staff and also patients. But it will come.
Yeah, well,
Good, excellent.
next item on my agenda is to chat a little bit about the health center endowment. Janet and Brian and I did a lot of work together on our budget this year, with operating out of a new facility, expanding our services. It has significantly changed our budgetary needs. And in our current economy, our operating costs have gone up. We are an equipment heavy operation with needing to purchase laboratory reagents and wound care supplies and recurring expenses for things that we use day in and day out, as well as needing to remain competitive in the market to recruit providers and keep providers from burning out. And that has come with some increases in our operating costs this year, that have been rolled into our new budget. We were fortunate to have a very generous anonymous donation that is subsidizing the cost of compensation for our new registered nurse position for the first year. And that was able to offset some of our budgetary needs. Our budget for the year has been passed and approved by the select board, and it was passed and approved at town meeting with no discussion. Yay. However, I have also been charged by the select board with starting some conversation about how we can make our process of funding the health center more sustainable, and making our funding processes a little bit more self-sustaining. And one of the ways that I would like to look at doing that is building the funds that are currently in our health center endowment that partially contribute to our operating funds every year. And I would like to charge the advisory board with developing some ideas and processes for fundraising to start to build up that endowment a little bit, and have some sustainable source of funds for the health center. And I know this has also been a idea that Peter has been very interested in. He and I have had some very good conversations about this. And I would actually like to invite Peter, if you have anything additional that you would like to contribute or share, I would like to offer you the opportunity to speak and share your ideas as well.
Well, I already said actually before you arrived that I think there is a potential there with a donor group that might not find other causes. It wouldn't be in direct competition with other fundraising efforts here. And I have to say that this is not my area of tremendous expertise, but it seems to me a separate endowment committee, far be it from me to ever suggest another committee on Islesboro, but I think even in anticipation of that, talking to some maybe seasonal residents as well as Islesboro residents with capacity, what they might find attractive. And I don't think there's a single healthcare facility in the United States that doesn't have wings, facilities named after somebody else. There's, the Sussman Centers over at Penn Bay, and I know Don Derrick for decades, and he was very generous, and somehow they solicited, he must have gone to Penn Bay and said, what do you need? And they said, this is what we need. So I think there needs to be an initiative in concert with Chris and your staff to decide what would be attractive. And I know Linda and others had said to me that it was pretty close on the heels of the original capital campaign, and maybe we wait a year to launch this, but I think we can think strategically about that. I think that the healthcare facility is such a large portion of the town budget at the moment, and it seems like if we could reduce the weight on the public sector funding mechanism by developing it, and I'm just sure that's what's done in many, many other places. So that's my thoughts about it. I would be very happy to.
Do you have any
Participate.
thought about how much you'd like to raise or should be raised?
I have no idea, Linda, because at the moment, we don't know what we're trying to raise money for. But it seems like you guys who know much more about the health center and its facilities and what it might need in the future, if it's the items that Chris just mentioned, or, you know, a piece of equipment that's very expensive. I think we need to have a list, a kind of wish list, and then we also need to have a discussion of, from people like Linda or Bruce who've done fundraising very effectively on this island, what might be a reasonable goal and what kinds of things might be attractive. And we could do a silent campaign to test the market and see whether or not we're on the right page. Something like that. But I have no idea, except that $2.1 million, is that how much was in the budget?
We were not quite that high. We had gone up from 1.2 to 1.4. And that was able to be pulled back, or it was able to be partially subsidized because of that one-time private donation.
So I don't think we're talking about, the data center in Salt Lake City. I was just hearing about it. This is not that big a deal, and it seems like it would be attractive. And if not right now, maybe a year or so from now.
Jane. My fundraiser hat's going on. And I just think that, we've had so many changes that to now just go out and start raising money is not a good idea. I'm hearing an awful lot in the community about not enough communication about our health center being out in the community. And I think that there's an expression, you need to take care of your own house before you go and ask others to start donating to it. And for instance, Beth, I didn't know that you were leaving until you and I met as patient and physician. You know what?
That was intentional though,
Right.
honestly, because I gave 9 months notice, which is a bit extreme, and I intentionally didn't talk to my patients about it until I had one-to-one chances with them. So,
Yeah, but
I
that's the
don't know.
kind of stuff I'm
Yeah.
hearing in the community that is not, that people are kind of feeling blindsided by, that they didn't know that Dory was leaving and that they didn't know that Chris was going to be. I think that's just my opinion. That stuff needs to be cleaned up before we go out now and start. Let's let them know what we're doing. For instance, when I brought Barry to you the other night, I didn't know that you had ultrasound. I didn't know that you were gonna be able to take care of him the way you did. And because, and others don't either. And I think if you promote that stuff and make people understand that this can be your primary care physician here. You don't have to pay a ferry and go across to see a physician on the other side because you guys can take care of us. And I think that that's important to get out there, that how you're now able to take care of us.
And I think it's a timely point, Jane, and really ties into exactly some of why I'm wanting to get the word out about our website a little bit more and get some of this information about this new publicly accessible way to know what's available in our facility out to the community.
Mm-hmm.
And I thought I acknowledged that now may not be the right time, but it may be the right time to, in a private sort of way, just strategizing what it might look like.
I think we need to toot our own horn
Yeah.
because it's a pretty special place we have.
Did you write that letter to the editor that I asked you to do about
No, I
Mary's
didn't.
visit?
You see? There you go. You know,
I would
I mean-
also like to extend the invitation that if there are any members of the board who would like to contribute articles highlighting our work for us to put up on the homepage of our website, that I will be happy to get those published.
I mean, you know, it's kind of annoying to me to hear that people don't know what's going on, because I tried very hard. I mean, I've been writing articles about all the providers and everything else, and I've included in there what their skills are, what they know how to do,
Mhm.
and everything else. Who reads the paper? Nobody. You know,
People can't afford paper.
yeah, I'm saying that part of it is
And look at it
that
like-
people are not subscribing to it, but you can go to the library and pick it up for free.
Right?
Okay, Sewing Circle has a subscription that any member of the Sewing Circle can pick up and read for free. So I mean, there are free copies lying around. It's not like you have to pay $40 a year.
So maybe we need to get creative about how we get our word out.
Well, one way might be to have one or two of the providers come to Sewing Circle and talk about the changes and what is going on now and what possibilities are there.
And sporting club and,
Sporting
and
club.
I was gonna
the
say,
Island Church.
There has to be other forums.
I think it's more important, other than driving people to a page to read, I think it's much more
Yeah.
important to engage. You know, I've never met you until that night, you know, but I have to say that I went away very impressed.
Thank you, that means a lot to hear that.
And we've been using we've only been, this is our sixth winter as year-round residents. But we've been using this health center 20 years probably. I mean, we saved all of our appointments for when we got here in the summertime. You know, and I think that, you know, that relationship building is real important for us. That's my opinion.
I have a couple of projects in the works, that are public outreach projects outside of the immediate operations of the health center, but are adjacent to our work. The one that is probably the most prominent, where I have an active request out to the community fund for some support right now, is the community CPR training initiative. And I'm going to have a spot on the docket at the next community fund meeting to talk with them about that a little bit more. Because our health center is an American Heart Association training site for CPR courses. Odessa and I are both instructors. And I think that's going to be a very good opportunity to get some health center visibility if we can start offering classes to the public and have a health center led CPR course on a regular basis.
It's very good. There are 88 members, all elderly, in the Sewing Circle. And was it last year I asked for Mert to come and do training on
It
Fire
was a fire
safety.
extinguisher.
And I cannot tell you how many women said, I've got one, I never touched it, I had no idea how to use it. And I think that's the same thing, I mean, if you just come and do a little training, these are all older people. Things are gonna happen, you know, that you just coming and doing a little training could save a life.
Yeah, I think that hands-on is important, and the website's great, but I know a lot of older people, my mother would never have looked at that.
No,
But if you'd gone to the luncheon at church and here we are, we can do that for you, you know, and I think that's.
there are
really
forums that get together every week that you could step into and reach a lot of people.
Well, how about you get together a list of where those ones would be and help us coordinate, because
Be happy.
I might be speaking for Chris here, and I'm only, maybe I should only speak for myself, but our plates are really, really
I was
full,
gonna say,
really full,
finding the time to do.
and they're
all
about
that.
to get fuller.
Mhm.
And,
Well, you wanna-
and efforts have been made, we've been in the paper, we've been in constant contact, there's been lots of public discussion about ultrasound, so if it's not getting out there, we need help.
Mhm.
I would agree.
Yep, we can help you with that. I mean, you know how welcome you are when you come for the flu shots to Sewing Circle, I mean, you line up. You know, it's like, shoot me. You know, but I think, and it's very much appreciated, that relationship.
So Jane,
Yes,
guess what?
I know.
You get to make a list of the forums, okay? And because we cannot possibly burden the providers with showing up at these fora, this is the job of the Health Center Advisory Board. Various members here need to be recruited to show up and talk about what the health center can offer you. And if you happen to be somebody who just has an earnest desire to have your name on something in the health center, let us know what that is, you know, kind of that kind of thing, because I think we can do both in an outreach situation to kind of do that soft feel that Peter's talking about. You know, somebody's out there really wanting to make a legacy with their name on it and have it be a part of healthcare here on the island. They might want to, you know, put something in their will about that kind of thing. They want to have their name on a room, okay? That's how hospitals do it. Every room has somebody's name on it.
You could also just make sure that people are aware of an endowment fund.
Yeah,
Exactly.
You know,
Yeah.
some people might want to give $5.
yeah, yeah.
And it might not be about a room, but I don't know if people are aware of the endowment fund existing.
Right.
And
I don't think people are. I don't know.
I have to say, as a
Never out there very much.
provider who worked per diem and was a pretty active per diem at the health center between 2022 and 2025. I didn't know that we had an endowment until I started doing our budget this year as a director.
Wow.
Yeah.
Thing is about endowment funds is they're a big deal. And they shouldn't be sort of trail along year in and year out. Oh, we have an endowment fund, because people won't give to it. You have to create a certain excitement about an endowment fund and a certain time frame in which you want to raise it. And you create a little thunderstorm, you know, or whatever you want to call it. But you just can't sort of meander along, because it won't get anywhere. And the people that say, oh, well, how's the endowment coming? Well, you know, you probably should start out with a substantial gift, and then you go from there and you create some excitement about it that people want to be a part of.
Having a gala?
But,
A gala?
well, you know, a picnic, I don't know, but something. And that takes leadership. That it takes somebody who wakes up every morning thinking, how are we doing today?
Yeah.
So, you know, we got to get to that issue too. But it's this sense of excitement that is and the good it's gonna do, which it would. But you have to get that across in various ways, and the Oslo Island is one way, but there are other ways to do that. Yeah, come on.
There is a space, you know, over the entry door, the peaked roof at the entry here. It's empty. There's no name on it.
Your name here for the highest bidder.
Exactly.
For a year.
Yeah, I was just
There
gonna
you
say,
go.
like, I'm a little bit partial to Islesboro Health Center being for Islesboro.
Yeah, and it's not really Oslo style to do that name.
No.
Well, we
Maybe-
do have the Kinnicut Center, and we have some precedent there.
Well, the other thing is, I mean, look
Yeah.
around, look at the library, the bricks on the walk, okay? Was a big fundraiser for the library to get those people wanted to put their names or make a memorial to their dog or something, you know? And it wasn't an expensive proposition, but he added all up, and it's spectacular, it's a lot of bucks.
So something
So,
like that, where your name is a part of many names.
yeah, exactly. So, and a lot of places have, you know, donation chart things, okay, little plaques that go on for, things. Publication that says, these gifts were given for this tier and that tier and all that kind of stuff. There are all kinds of strategies that people who raise funds regularly use for that kind of thing. And again, as I say, we got lots of people around on this island who are members of organizations that do that kind of thing. We should, we can pick their brains.
I think we lost nine people this year to death. That memorial board could fill up real quickly, in memory of,
Yeah.
just in memory of.
Yeah. Because almost everybody who died, their family put a notice in the paper saying the health center was wonderful.
Mm-hmm.
And I have to say, some of the people that we've lost in the past year have been very prominent friends of the health center over the years as well.
But there's little side stories that need to be told. Like yesterday, somebody said that Kathy Kerr, this is, SIPA, it was talked about at Circle, that Kathy Kerr had to take Mike, or that he went in an ambulance and then she's over there without her car and she wants to know how she's gonna walk him back onto the ferry because he's not sure he can walk. And lo and behold, Owen steps up and says, we can get him a chauffeur. And off goes Amanda O'Bannon to be their chauffeur. That kind of stuff is what makes this community. And it needs to be shared that this stuff can happen, and, Owen stepped up again.
Well, I'm not sure how you can share those stories.
Well, you can share those stories if you get written permission from Kathy, and Mike, who would be, yes, tell my story, who Amanda would say, sure, go ahead, but it has to, regulations, you have to be able to get permission for that. But I think they're really good eye stories that need to be shared. This doesn't happen on the other side, tell me. My son said that the night that Owen delivered aspirin to my driveway. He was just like, this is your health care out here? I've stopped worrying about you, Mom. So.
Well, maybe we can add to the website a spot where people can share their own story.
Oh, that's a
I
great
think
idea.
It's for.
And that might
handy
bring more
information.
people to to the stories, because somebody would say, oh, I put my name and my story on the website.
Right.
Yeah.
Good idea.
They would I think, have to submit it to Chris to put it on.
They would, just in terms of the mechanism, that there may be a way that I can set up a field where someone can type in their story and send it to me entirely within the.
Right, because we
Content
want to
of the
make sure
website.
that if there was HIPAA stuff involved, that it wasn't. I mean, if somebody's just saying, I've just had wonderful care and I had an ultrasound diagnostic study done that was helpful, that's not necessarily HIPAA violation because it has nothing to do with what was wrong with you.
Exactly.
So you can edit those kinds of stories to make them HIPAA compliant. But it has to be we have to be careful about that. I mean, it's so stupid. People can go online on Instagram and say everything about their personal health care that they want to do, and nobody sues anybody about that.
So I would just like to go back to, I think that this year we should really focus on getting more out there information wise before we start to, and with the charge that we're going to come at you and ask you for money at some point, but let's, let them know what they have the opportunity to support.
Right. So Jane, I'm gonna give you the assignment. Your job is, number one, to make a list of forms. Number two, to recruit individuals from the Health Center Advisory Board who will talk to people in those various fora, okay? Whichever you happen to be comfortable with, okay? If necessary, I'll make cake.
And then the other piece of that would be, I know you guys are out straight, but if you are offering Red Cross CPR classes, perhaps we could do them in certain places, not necessarily just there.
Yeah, the classes are pretty portable. It would be pretty easy to do. And we can tailor that to the audience a little bit. The CPR classes are pretty physically demanding to do the skills. And I think depending on whether it's I think if it's a population mostly of individuals who have advanced directives and don't want CPR, maybe a first aid focus, caring for injuries that occur in the household, is a good focus, and we have some latitude to be able to do that. Anyone in this room who's on the community fund?
No, I have a connection.
Uh,
Michael's on it.
Oh, perfect. The upcoming conversation next month is going to be important for getting the books from American Heart Association and materials and certificates to make those programs happen. And we also have a request for an initiative for a program called Walk with a Doc, that was started originally by a cardiologist, to get his patients moving. And it is a program where there are now chapters around the country where these sponsors will provide brief patient education on a health topic, followed by doing a walk around the community with their patients. The initial startup to form that chapter in Islesboro also includes some swag, some t-shirts and pedometers and things that we can give out to patients as incentives for participation. So that's another opportunity to connect with the community, and two things that are upcoming on the community fund docket that would help us to achieve our goals.
And we might be able to pair up with like Colleen Dove already is doing a 5K and a walk thing and, or the ice cream walk or what, we might be able to pair up with those events.
Colleen would be a good one to talk to. I'm doing CPR training for her Adventure Camp staff next month. So there's already some partnership in the works there.
And I've always questioned, you can answer this, why don't we do blood drives out here?
Why don't we do?
A blood drive.
Well, because the Red Cross has to do them. And number one, they're not gonna go someplace where they are pretty sure they're not gonna get a certain number of people because you have to organize your whole business. You have to move it and you have to get on the ferry, you gotta get off the ferry. So it's a time restricted period of time. And they're not gonna move it unless they have enough people who are gonna show up for that. And I don't know, as busy as people are in their work days here, that's ever gonna be a high priority.
They've had them in the past. I don't
I
know
was
if
gonna
you were
say,
here, but
No, I wasn't.
Yeah.
I remember maybe 2 or 3 only one life.
Yeah, I think there's been some in the past, but I mean, that's the big deal. It's not something we can organize.
So-
It's something that the
so
Red
hard to
Cross
get-
has to do.
On the boat.
It's
If we
also
can't do that, then it seems to me there is a blood shortage. And we should be
Oh, it
making
is.
people over here aware of how closely they can go to give blood.
Yeah.
And there's another PR thing. Health centers telling you what you can, where you can go to do what you wanna do health-wise, that kind of thing. But blood drives it's a good place for publicity.
They definitely are. And unfortunately, and I don't know if all of you know, we do not stock blood products at the health center. So any of the administration of those products would happen on the mainland. We do not have the licenses or the medical technologists to be able to operate a blood bank here. And there would be significant additional expenditures involved in maintaining local inventory.
Yeah.
Now, Penn Bay and Waldo is absolutely using that product.
Here's something I learned recently. I'm sorry, I'm taking a long time, but here's something that I learned recently that I think we could share with our community. If you're involved in a catastrophic illness here, and you have to go over to the mainland a couple times a week on that ferry, I just learned that you can apply at the ferry office for an application and they will pay for your ticket and they will make sure you have a reservation there. I had no idea. And this was just discussed at Sewing Circle the other day because we have an anonymous donor that wants to help one of our members who has to go back and forth 3 times a week. And that anonymous donor has made a nice donation and will continue to fund it if it depletes. But when I called and asked, when I started to talk to the spouse about it, he said, oh, well, the ferry service has this. And I was like, I'll be damned. So there's another place that information should go. I mean, you have to apply, but nobody knows, and not everybody knows you can apply for that. And that
It's a very
through the ferry
easy
service,
application.
through the ferry
process.
service,
Yeah.
DOT, you go up and you ask for the application at the office. And it might take a little time, but they will make sure you have a reservation and fund you going back and forth.
So that is a one-on-one conversation that we've had with plenty of patients who are in need of that service.
Mm.
You know, we're aware of it and we've helped arrange it, but
Okay.
it's not something that,
Yeah.
we've necessarily felt the need to get the word out about because we have the knowledge of who needs it and how to get it for them. And any provider, anybody who's seeking treatment on the mainland, I would assume that their provider or nurse case manager or social worker is also aware of that program. When somebody is diagnosed with a significant illness that requires continuing care, we routinely, it's just a standard of practice, routinely assess whether their ability to access care. You know, the social determinants of health and how to support them in that process. So we could certainly get the word out, but I want to assure you that any patient of ours that has needed that,
You're doing it one-on-one.
Uh-huh.
Yes.
We've
Yeah.
always had the applications,
yeah,
usually right at the health center. But it's the people that might not have care, that might come for the summer that need something and they might not even connect with you guys that.
Mhm.
Yeah, and you know, and the bottom line is that added stress, if you don't know, and now you're dealing with a patient, I mean, a family member that, then, you know, I think that it would be helpful if we knew that.
Yeah, we can add it to the list of things to get the word out about.
It could go on your website.
Yeah.
Yeah.
Yeah, sure could.
Yeah.
Under the community resources.
All right, that concludes the items that I have in my report as director.
Okay, well, we don't have anybody zooming in from the community that I can see. Do we have any committee reports? I don't think we do. Okay. The next meeting is the 12th of August at 10:30 in the morning. Is there any other business that we haven't dealt with today? Okay. All right, so Jane, you got a lot of homework. You're a committee of one woman. But you got a lot of energy and we're gonna use it. Okay.
Thank you.
Yeah, but remember, you should be able to call on any of the other members of the committee, the Health Center Advisory Board, to help you out with any of these group things, okay? Because I think it's one of the things that we should be doing as members of this board.
And once you have dates and times, please let us know, because I don't want to come across as us not wanting to be a part of it, but as far as the outreach to do all the setting everything up is time consuming and my personal and professional practice goal is to start delegating where I'm able, so I can focus on what is within my scope that can only be done by me. So, but if, once you have the dates, if you let us know, I'm sure that we can find a way to have a provider participate, do you think, Chris?
Yes. Most definitely.
Yeah.
And a number of, particularly the CPR trainings, I'm actually planning on running a number of those myself as lead instructor.
All right, so this board is beginning to do work, which is a good thing. Besides getting health center built and all that kind of stuff. Oh, I have one other question for you, Chris, because people have asked me. How's recruiting going?
I have some feelers out. We interviewed a wonderful candidate this past Friday. And between the time when she interviewed with us and yesterday afternoon, she received notice from the Army that she is being deployed to the Middle East. So I am continuing to put feelers out in my network, including among the recent graduates who have been my students at University of New England. I don't think that we're in a spot where a brand new graduate would be ideal for us. I think that because we are so independent and so remote here, at least 1 to 2 years of clinical practice experience, if not more, is ideal. So I am looking not so much at the new graduates, but some of the recent graduates who now have possibly 2 to 3 years of practice experience, have worked for a couple of years and figured out what they do and do not want in an employer and are maybe looking to make a change from their initial position. I also have a goal of expanding our per diem provider pool a little bit. Not necessarily to increase the percentage of our coverage that is provided by per diems, but for us to have a little bit more depth to reach for, and to make it more likely that we have someone available when a member of our full-time staff wants to be able to use either their vacation time or their professional development time.
Is there a job posting somewhere?
Not yet. We approved a position, and we wanted to have an initial conversation with this candidate. I am anticipating that we are going to need to do some posting and recruiting, and I'm anticipating we're probably going to need to do that outside of the immediate local community. We're probably going to have to reach out to the Portland, Augusta, Bangor, and maybe even Boston areas and cast a fairly broad net. There's only one PA school in Maine. And PAs are very highly marketable. There are a few more family NP programs. Some of our family NPs, and Beth, you can probably speak more to this than I can, have found that their specific training leaves them a little bit less prepared for managing some of our call and emergency responsibilities. And that's something that has taken a little bit more activation energy to really build up that comfort and that skill set. PAs do an emergency department rotation as a required part of their clinical training. So while I will certainly consider a family nurse practitioner with the relevant background in emergency care, the PA role is probably going to be our best fit for a full-time candidate.
Yeah, I would agree with that, having gone the family nurse practitioner route, which is where my comfort level is. There's a very heavy focus on primary care. And I think a family nurse practitioner with any kind of hospitalist or emergency room experience prior to taking this position would do well. But personally, I started it as a new grad with my training in family medicine and a strong interest in behavioral health, not emergencies. But there was a need and I was here. So, we did what we could with all of the extra trainings and me doing the EMT course, and, I would not recommend us doing that again, because without the strong ties to the island, you'd have a hard time keeping somebody on call like that when they're not, that's not what their background is. Does that make sense? Yeah. Whereas a PA student has done the, you also have a clinical round in a hospital, right? It's like
Yes.
a hospitalist following that person, yeah.
Yeah, so they hospital or inpatient internal medicine rotation as well as emergency department and surgery. Those are all required rotations for all PA students.
Yeah, and those differ, whereas the family nurse practitioner program actually limits the time you spend in specialty. It limits the time, my particular program limited the time I could spend in an emergency setting or in a hospital setting because the focus is very strong on primary care.
There are various programs though, because I've encountered nurse practitioners whose primary job was in a hospital setting.
That is true, and there's actually an acute, that's the difference with PA. There's one PA track, and PAs get that experience in each one. Nurse practitioners, you can do a track and certification as an acute care nurse practitioner, a psychiatric mental health nurse practitioner, a family nurse practitioner, a women's health nurse practitioner, a certified nurse midwife. So the time spent in school is different, but depending on your track, your coursework is very different. I did the family nurse practitioner track, so my coursework was very heavy on the primary care setting, addressing the social determinants of health, as well as, the reading on the blood pressure machine. Whereas a PA gets the broader, education. Would you say that's?
I would say that's the case. And that the reason that we really need to utilize the family nurse practitioners specifically for our NP positions is because their licensure allows them to see patients across the entire lifespan. The acute care nurse practitioners are restricted in their licensure from seeing pediatrics. Acute care pediatrics are typically seen by a pediatric nurse practitioner, which is a separate license.
That's a newer separate license.
Yeah,
So
there's a
six-
PNP,
Yeah,
yeah.
yeah.
Yeah, I was gonna say it's time for you to leave, okay, and it's almost time for us to adjourn here anyway, okay? But anyway, so you've got interviews out.
We have interviews out,
The federal government has taken away somebody else again.
we also have a very promising candidate for the registered nurse position, who we have interviewed. And she has passed her background check and her reference check. So next steps are going to be moving forward with talking with them about an offer.
Okay, good, that's good to know. All right. Any other business that I haven't thought of yet? Thanks, Peter.
Thank you.
Then we have a move to adjourn?
I so move.
Second, anybody who is opposed? Okay.
Thank you all very
Yes,
much.
thank you.
Hmm.